Hello, everyone. I'm Dr. Angela Mattke, and you are watching Ask the Mayo Mom on Mayo Clinic's Facebook Live. I'm a pediatrician at the Mayo Clinic Children's Center, and twice per month I host a show about pediatric health topics where we take and answer your questions live. May is Mental Health Awareness Month, and today my guest is Dr. Rachel Lynch. She's a pediatrician at the Mayo Clinic Children's Center who specializes in the treatment of mood disorders in children. Dr. Lynch is also an instructor in the REACH Institute, which is a nonprofit organization where she travels across the country to teach medical providers how to better screen, recognize, and treat mental health disorders in children. So today we will be specifically focusing on anxiety and depression. Please send us relevant questions today regarding the topic, and we'll try to answer them as best as we can. So Dr. Lynch, thank you so much for joining us here today.
Yeah, I'm really excited to be here. I'm excited to talk about kids and families and how we can help them more when they're struggling.
Let's start the conversation by talking about anxiety, because I feel depression gets a lot of much more kind of media coverage, but anxiety disorders are really quite prevalent in children and actually potentially more prevalent. So how prevalent are they? When would we start seeing these symptoms in children?
Yeah, so anxiety disorders are really common in children, even more common than depression. And I think sometimes families and even medical providers don't recognize that can be what's going on for a child. Mm-hmm. So when I get a chance to talk with families or providers, I always like to point out that anxiety really can cause problems for kids, even starting at a pretty young age, mm-hmm. and that we really should be on the lookout for it. And it sometimes gets confused with other disorders, and we want to recognize it whenever we can because it has good treatments, and we can really help kids and their families.
The symptoms of anxiety can really look quite different depending on what developmental age the child is in. How do you differentiate like normal developmental behaviors maybe in a toddler as opposed to something that would be more concerning for it be underlying from anxiety? Yeah,
so a really great and interesting part of pediatrics is that kids have mm-hmm. all these developmental stages mm-hmm. that we get to observe over time. And I'm a general pediatrician, so I see kids from birth to teenage years. Mm-hmm. And so it's really important to recognize that what is a normal behavior in a young child. So you mentioned a toddler. Mm-hmm. They would get nervous about being separated from their parents. And mm-hmm. when they're young, even 8-9 months, we can see they get worried when their parent leaves the room or they can't see them. And that's demonstrating some separation anxiety. Mm-hmm. And that's normal at that age, and even up through the preschool age sometimes. Mm-hmm. But as kids get older, if they have this fear of being separated from their parents, mm-hmm. that's not something that we expect. We expect them to be able to go off to school, to be able to have fun with their friends. So if that separation is difficult as they get older, then we worry this may be a problem, or it could even be a disorder. So that's one example.
Right.
There are lots.
Right, exactly. What are some of the common symptoms of anxiety in children that parents should be able to recognize and bring to their medical provider's attention if they're concerned about it?
It's hard to recognize symptoms of anxiety sometimes because we all have worries. Like we have to have worries in our life to keep us safe. Mm-hmm. We teach our kids to worry about crossing the street. You have to look both ways because if you don't, something bad could happen. So differentiating what's normal worries mm-hmm. for a child from what might be a disorder is hard. But anytime you think, these worries are more intense than I expect, and I've tried to reassure my child, and it's not working. And if it's holding back them from doing anything we expect them to do with their age, mm-hmm. like I said, like going to school or going to sleep. So mm-hmm. sleep problems are a really common presentation or a symptom we might see when kids are struggling with anxiety. But in our offices, we frequently see, and school nurses might see this too, that kids come in a lot with headaches or stomach mm-hmm. aches, mm-hmm. and that's a sign that they're having some anxiety. And it can be really hard to tell. It can be hard for parents, and it can be hard for nurses that meet with them, or even doctors sometimes. So, but if you're concerned about your child and their level of worry, then we'd want to see them.
With children that have eventually been diagnosed with an anxiety disorder, like looking back, sometimes those symptoms were there, but maybe they weren't to the level where we call it causing functional impairment, mm-hmm. right? So maybe it may have started early on with difficulty falling asleep, but as it becomes more and more difficult for them to do the things that they're supposed to do, it becomes more apparent to the providers, to the parents, to the teachers, those kind of
teachers.
things. Mm-hmm. Absolutely. So you mentioned stomach aches and headaches and stuff like that. And so one question I often get from parents are these headaches and stomach aches real? Should I believe my child if they are causing their anxiety? What are your thoughts on that?
Yeah, so that question, are they real, is a tough question. And part of what we're doing as a medical provider is trying to sort out, say, the reason a child comes in is headaches. We're trying to figure out, maybe they have migraines, maybe they have another cause for their headaches. But as we go through the questions and the physical exam and we see that there are normal findings, then we start to think maybe anxiety is contributing to this. And then we'll talk about how do we diagnose anxiety. We go through that. But those headaches, if we don't find a cause on our physical exam or other tests, it doesn't mean they're not real. The child's really experiencing a headache, but can we identify an underlying cause that is, something like migraines, or is it something like anxiety?
Exactly. And if we start to treat the anxiety, some of these physical symptoms that they're feeling from the stress and the worries can actually improve, right?
Yeah.
Okay. So why is early identification of anxiety important in children?
So identifying even just what are normal worries or worries that are becoming a little bit of a problem and not yet a disorder are really important, because interventions can help even at that early stage. And interventions, by saying that, I don't mean like they have to go to a therapist or something, but just having parents or people around them realize that you can help kids face their fears early in life, or early when there are signs of worries, and that they can avoid some future problems, or maybe ever having trouble where they have difficulty going to school or having fun with their friends. If we can notice fears and help them face their fears when it's early on.
Are there certain risk factors that would maybe put a child at increased likelihood of developing anxiety, or risk factors for that?
Yeah, so we know definitely for anxiety that it can be something that's a tendency you have when you're born, so a genetic potential you have to be more anxious. And then things in your environment can influence that too. So it's really common, because it runs in families, that a parent or a caregiver might also have anxious tendencies naturally, and they might show those tendencies, and then a child picks up on those things over time. And we're all, as parents, we're all doing our best, and we care about our kids, right? So we worry. That's our job, and so trying to help them see ways that you face your fears too, and overcome things that you're worried about can be helpful. So those are risks. Now, those are risk factors for having an anxiety disorder, but things in your environment, other things in your environment can trigger symptoms, like severe symptoms of anxiety, such as bullying, or exposure to things that are scary or traumatic for a child, or big changes in their life. And that itself doesn't cause an anxiety disorder, but can really trigger the symptoms and trigger a time in that child's life they need a lot of support.
Absolutely. Symptoms of or children who have experienced significant trauma in their life, which can be many different things, from abuse to homelessness, from bullying to violence. Sometimes they can present with symptoms we see in children of anxiety. How do you go about making that differentiation and the diagnosis?
Yeah, so there are things specifically like PTSD that used to be considered part of the anxiety disorder spectrum, and it's separate now, but symptoms that children experience after they've been exposed to trauma can look a lot like anxiety. A lot of the same resources will be helpful for children that are experiencing those symptoms. So again, just identifying, is the child struggling with things we expect them to be able to do easily at this time in their life by sleeping or going to school or eating regularly and having friends and having fun with their friends. If it's interfering with that, then we want to find a way to help them get help.
Let's talk about how we actually make this diagnosis as medical providers.
So when kids come in, whether it be that a child comes in with their parent and they say, well, my child's worried a lot, I think they might have anxiety. That happens sometimes, and then we proceed with that. More often, it seems like they come in because maybe they're struggling with school, maybe they're really having a hard time sleeping, maybe it's these headaches or stomach aches that we've talked about. And then we have to start that evaluation, and we have to consider medical causes, especially, or some kids feel their heart racing when they're anxious, and we have to think about, could it be a thyroid problem or something like that? For their stomach aches, we have to consider those medical causes. So we do that by getting to see your child, interviewing them, talking with them in the room, doing a physical exam. But when we really start to suspect that they could be having problems with anxiety, we often have questionnaires that we want parents and sometimes kids to fill out. And we give a lot of questionnaires when kids come in now, so we feel bad. But the information helps us a lot. And sometimes we even want information from their teachers or their school because they can help us understand how they're functioning at school. Absolutely. So we use a lot of questionnaires. For anxiety and for depression that we'll talk about, we don't have a specific blood test or an x-ray that tells us, yes, this is what you have. So we try to gather a lot of information and take time to talk with the parent, the family members, the child themselves, to get as much information as we can.
All right, so you've made the diagnosis of an anxiety disorder, and there's many different types of anxiety disorders. So let's have you talk a little bit about that, and then I want to get into talking about how we do treatment. We have some great questions coming in from families about that.
Sure. So the different types of anxiety disorders have changed a little bit, and it's not that important because the different types of treatments help with all of the different types of things that are labeled as anxiety disorders now, and even our diagnosis is also very similar. But there are things like social anxiety, like panic disorder, and then generalized anxiety disorder, and sometimes treatments are slightly different, but for the most part we treat them the same. Obsessive compulsive disorder, which is OCD, is now not technically an anxiety disorder, but again fits with some of the discussion we're having today and has some similar treatments. And PTSD is separated a little bit. For kids, we even have a diagnosis specifically of school avoidance, which is when they're really anxious about school specifically and not able to attend. So
absolutely. So you said the treatments are pretty similar. Let's talk about the treatments and the therapies that we use in kids.
Yeah. So for the anxiety disorders, the generalized anxiety disorder and other subtypes that we talked about, there are really great studies. So it's as I've learned more about anxiety disorders, I've been able to talk to families much more confidently about what is going to be helpful. And just that alone, knowing that there really is something that helps, can really comfort kids and adolescents and their families when they're struggling with this. And so specific types of therapy, so cognitive behavioral therapy, and with that there's often exposures or exposure therapy that happens as part of that, depending on the child's type of anxiety or the fears that they have. And that is shown to be very effective to help children that are struggling with anxiety. It takes more than 1 or 2 sessions. You can't just go once or twice. It's a process of sometimes 10 or more sessions, but that can be very helpful. We know that by itself can improve quality of life for kids a lot and teach them things that's going to be helpful for them their whole life. So I really stress that with families, and that, starting as early as age 9 for some kids, and maybe a little older or a little younger for some kids, that therapy can be really helpful. And then medicines are also helpful, and the combination of medication and therapy is what we know is the most helpful from really good studies.
One thing I share with families about is not just the therapy sessions that they're going to do, they're going to have homework to do.
Yes, that's so important.
Yeah, so it's not just going and showing up to your sessions, it's taking what you learn and you practice in those therapy sessions and incorporating them into real life situations, so that when I talk about it like as a toolbox, right?
Yeah.
So when they need it, when they're feeling these symptoms, they're really good at using it and they can pull that tool out. Because it's kind of like basketball. If you're not practicing, you're not going to do very well in your games.
Yeah.
So.
And like I said, I'm a general pediatrician, so I don't do the therapy.
Yeah, exactly.
And I've come to learn more about the therapy in working with kids and families and working with psychologists or social workers who are trained to do the therapy. And it's a really important way to check in with, well, how is the therapy going? Are you getting homework? Since I'm not doing the therapy, I want to know, are you getting something that's really helpful? And are you making steps towards facing your fears?
Absolutely.
So that's really important.
Absolutely. So you mentioned therapies and medications. What can parents do to kind of help themselves, both with their own mental well-being and also help their child?
Yeah. So like I said, as parents, we're all doing our best. Parenting is tough. Like we both have kids, we know that parenting is tough, and we're all doing our best. But there are times that we really need other support for our children. So reaching out to professionals, like we've said, but also having other loving adults in their life that can offer them support is really key at some points in their life, and that can be coaches or teachers or school counselors. So that can be one thing. And then understanding, just getting a little bit of understanding about what are things that I can do to help my child. And there are books and websites and resources that are helpful to point out to your child when they do well. We teach this with all sorts of behavior concerns, but catch your child doing well at things and point that out. And same thing with facing their fears. So something they might have been scared about, and now they do and they enjoy it, making sure to point that out to them.
We have a good question from an audience member, and they want to know what interventions or how they can help prepare their young child to go into situations that cause anxiety for them, like going to the doctor or visiting the dentist's office. What would you suggest to kind of help them prepare their child?
Yeah. So when you know something might be scary for them because you've seen them experience it, and you as a parent, you know your child the best. You see their nonverbal, the things they show you that they're scared, and maybe they've already gone to the doctor once and that was scary. So having them practice at home with things like a stuffed animal can be really helpful, or having, even if they're toys, but medical, a stethoscope or something at home, and letting them practice, putting it on your chest or putting it on their chest. Those things can help them. But then really reminding them that, you went to the doctor, or maybe you went through something else before that seemed scary, and maybe it was. Maybe there was something that was painful for a moment while you were there, but it helped you. Now you're healthy, now you're better, and we want to help you stay healthy, so we're going to go visit the doctor again.
Absolutely. I think talking to children about what they're going to experience, so you give them time to prepare, and not having that very sudden change where they have fears that they haven't been able to kind of talk about and practice through things. I also keep a couple play doctor kits in my office, and so the nurses on our team will automatically bring it in for like the younger toddler age group if the kid's really scared, really reluctant to do things, and that really helps because you're kind of you're almost desensitizing them to some of the tools that we use and making it much more friendly, much more welcoming to them.
Yeah.
So.
And as often as you can for kids, giving them choices. There's some things they don't have a choice about, and we're going to go into the office, and you're going to have to sit, while you get examined. But asking them sometimes, which ear should we look at first?
Exactly.
It just really helps kids feel like they have a choice and some power in the encounter.
In those situations. Other things I think that are helpful are like doing books where they can read about it, where other like situations, some type of bear they're familiar with, from books like Corduroy, looking at how Corduroy goes to the doctor and he does fine and stuff like that, or showing them pictures of a dentist seat so they know what that chair looks like, so it's not so frightening when they get there. Having them go along with a sibling before they go to the dentist visit so they can experience that. Those are all kind of good practice scenarios where it's non-threatening and they get to be exposed to their fears, right? But a non-threatening environment.
I hear a lot about Doc McStuffins.
Yes, I do too. I think Doc McStuffins has helped us a lot, I think, in the medical practice. What about resources for families that have a child who's experiencing anxiety? What would you recommend to those families?
Yeah, when you know a child struggling with anxiety, there are books, as I mentioned, and websites that can be helpful. The CDC has what I always feel like is very reliable information about anxiety disorders and resources that are available. The NAMI, it's NAMI, is also a great resource because sometimes your child's struggling with anxiety, but sometimes you don't know. You're just concerned, and they have a really good list of kind of warning signs or videos that you can watch about things to be things that you might notice in your child where you really should take action and seek help for your child.
Absolutely. Well, thanks for talking about anxiety disorders. And I feel like anxiety disorders and depression are not completely separate entities. We see a lot of children who are experiencing symptoms of both. But like I mentioned in the beginning, we hear a lot more about depression. And is that because the rates of depression are actually increasing, or are we doing a better job at really identifying mental illness symptoms in children?
Yeah, I think there's some evidence that both of those things are happening.
Mm-hmm.
So I was just at a pediatric academic society meeting, and there was research presented about increasing thoughts of suicide, which often goes along with depression. And so there are studies that are showing us that some of these symptoms of depression are increasing when we look for them. But one issue is that a good issue is that we're looking for them. So as primary care providers, we've been instructed, it's really important for us to be screening for depression. And that's because it is a leading cause of problems for kids at this age, where if they do have suicidal thinking, or if they complete suicide, it's a leading cause of death for adolescents still. So we want to be watching for depression and do anything we can to intervene to help them before it would get to that point.
Okay. How do we watch for depression? What are those warning signs that we should be watching for?
For depression, I think everybody always thinks about a sad mood or a low mood or tearfulness. And everybody experiences that sometimes in their life, and maybe for a day or maybe for a little longer. But if it's really going on beyond 2 weeks, that's a time that we think, even if something very sad has happened, if that low mood is going on for a long time, it's something that the child needs to talk about with someone or an adolescent. But for kids, that's not always how it looks. So sometimes what shows up more often is kind of an irritable mood, or I ask kids, are you easily annoyed by people around you? And I often get a yes, and then parent shaking their head. And again, that's something that can be normal. We expect that, especially in a close confined environment of a family. Sometimes you all get on each other's nerves. We expect that. And we want teenagers to be learning to separate themselves from their parents and their families and becoming more independent. And but if that irritable mood is lasting for more than a couple weeks, and if they're becoming more withdrawn, so as a parent, you may see your teenager less often as they get more independent. But if when they're home they really don't want to be around their family, or you're seeing them withdraw from their friends, those are things that are concerning. And if you're seeing any of those signs, plus you're also concerned about any substance use with alcohol or medicines that aren't prescribed for them, or drugs, then that's really a time that we're worried that they need to get some help.
Okay. Who should parents turn to when they're concerned about their child? And how do they ask their child about if they have concerns? Yeah.
So we know sometimes it's really hard to first identify that you need to talk to someone because you're worried about your child, but then it's hard to know, where do I go, who do I turn to? And fortunately, some kids have a lot of people in their life that care about them and are gonna be supportive, and that can include school counselors, even school nurses, doctors that they've known for years, or even therapists or psychologists if you can get access to them. As a primary care doctor, I want to be open to talking to families when they have these concerns, because often I've known the child since they were very young, and I've gotten to know them over time, and the child trusts, that we've talked to them about many things. Right. And it can be hard to bring up to your child that you're worried about something like depression for them. But by talking about this today and getting questions from people, I want it to be easier for people to see, if your child has a cough and you're worried about the cough, and you're going to call someone, probably your doctor, and have them check on it, because there might be a problem, and there's probably a treatment that will make it better. And that's true for depression, and it's true for anxiety and other disorders. And you might not know what it is, but we want to help figure it out, or connect you with the people that can help. Because sometimes as primary care providers, we can't do all this. We don't do the therapy. We sometimes help with medicines, but sometimes we need more expertise from psychiatrists or psychologists. And when we know about those resources, we want to be able to help connect you with those.
Okay. We have a question from the audience that is asking about how early can you begin to see the signs of depression in a child?
Thankfully, depression is rare in young children, at least in the ways that we can understand and identify it. It's quite rare, 1% to 2% in children before onset of puberty. So if you're worried about that for a young child, I would say contact someone right away. And as a primary care provider, I'm going to connect you right away with psychiatry, or as soon as I can with resources that are even have more expertise. For adolescents, it is more common, and somewhere between 5 and 10% of adolescents may have a depressive disorder at some time in their life.
Parents or other people are sometimes concerned about asking their child if they're at risk for harming themselves or suicidal will increase the thoughts or the likelihood that child may, one, start to develop suicidal thoughts, or two, actually attempt suicide or commit suicide. Is that true by asking your child about suicide that increases those risks?
No, so it's been well established that by asking, have you ever thought of wanting to hurt yourself, or are you having thoughts of wanting to end your life, or that will not bring up an idea that a child's never had before, or promote the idea. It's sharing with them that you're concerned. And I feel like in schools more often now, kids are even getting teaching about mental health disorders and how to help their friends if they're noticing concerns. And so I'm really glad. But I know as parents it's hard to know what do I do in this situation? This is so hard. So it doesn't hurt to ask your child. It's not going to make it more likely that would happen.
Right. You bring up, the schools doing a lot of mental health awareness, and that kind of brings me to another thought. There's been a lot in the media about either books or TV shows that maybe are dealing with mental health and maybe not in the ways that we would wish that mental health was being identified and treated in teens. And there's been concerns that there's been some sensationalization of suicide. Can you share a little bit about that?
Yeah, so it's great when there are things that are raising awareness about mental health disorders, but we want to raise that always in a way that points out resources that are helpful and identifies that this is a mental health disorder, either depression or anxiety, that this is a medical problem that there's treatment for.
Right.
And there are people who want to help, and I know it's hard in some areas to find the right resources, but keep reaching out, find someone who will listen to your concerns, because there really are people who want to help. So that's one concern with some of the popular shows that have portrayed mental illness or suicide, is that those things haven't been pointed out. And it can, if it's sensationalized or if it looks like it's romanticized to children, it can sometimes be a concern that other kids might try this.
Okay. What about identifying other ways of self-harm, such as cutting? We have an audience question regarding that. What would you recommend for parents to watch for, and what should they do if they are concerned that their child is inflicting harm in some way?
Yeah, so kids who are struggling with a mental health concern, or who are feeling pain for some reason, will sometimes inflict self-harm, not with the intention to end their life, but sometimes will be doing some self-harm behaviors. If those are identified, of course, I think the person asking knows if that's identified, you want to seek help for your child, and therapy and counseling is the most helpful when you're seeing that. Okay. But trying to know, is this something that's a problem for my child or someone I know, can be hard, because kids often want to be secretive about it. They don't want to show that this is something they're doing. And so being alerted to the fact that if they're always wanting to stay covered, even in really warm environments, that it might be because they're trying to cover scars or cuts that are on their arms or their body. And again, approaching that in a way that this is something you're worried about, and just asking them is the best way to approach that. And it's not going to introduce a new idea that's going to cause a problem, but you may identify a problem that's going on that you can get them help for.
Okay. Let's end by talking about what are the treatments and how effective are they at helping kids that are really struggling with this type of pain?
Yeah. So treatments for depression vary a little bit on how severe are the symptoms that we're seeing. And again, everyone has some sadness at some points in their life, but when it gets beyond this point that it's been going on too long or is making it hard for them to get to school or get their schoolwork done or have fun with their friends, sometimes what kids need is what we call in the medical field just active support. So we want to recognize that they're struggling and that we can help them and that we want to check in and we want to encourage them to eat a healthy diet, to exercise, to get enough sleep, and to find social supports, ways to have fun with their friends or other people who love them. And sometimes that's enough, but often kids need more if it's been more than those 2 weeks of depressive symptoms. And then therapy, that's, again, this cognitive behavioral therapy with a therapist is shown to be helpful. And we look at different ways to measure effectiveness, but we generally, I would say, can be up to 70% effective, 60 to 70% effective if kids are really engaged in this therapy and attending multiple sessions. And then medication on top of that, or medicine by itself can be of benefit, but it's always works the best to have the therapy along with the medication, and the two of them together can be even more effective, up into the 80th percent. But medication alone is a little lower than that, but is beneficial. And if that's if you don't have good access to therapy, but you can get access to medicine, it really can improve the quality of life for kids and their families.
A lot of school districts have been recognizing, the mental health needs of children and trying to have therapies that are available on site. So for some places maybe that don't have as many resources, talking to their school, would that be a good idea to see if they have any access to therapists there?
Yeah, it's a great place to start.
Yeah.
So many schools have counselors, or some even have a school psychologist that can offer some help at school. Or some of our schools even have some chemical dependency resources. They are always aware of resources that can offer even more help if they're not able to offer enough help for the child at school.
Okay. One thing we like to share with teens is the suicide prevention line. Do you have that number available to share?
I do.
Okay.
I have the suicide prevention number, and the best is the 1-800-273-8255. And that is a suicide prevention line that's open 24 hours that kids or families can call.
That is a construction that you are hearing in Minnesota. We have 2 seasons, winter and construction season, we call it. So, but that is the end of our show for today. So we'll wrap it up unless we have any other questions or anything else that you want to add, Dr. Lynch. Do you have anything else that you want to make sure we
No,
touched
just
on?
make sure you reach out and find a provider you trust to help your child if they're struggling.
Sounds good. Thank you so much for joining us today, and thanks everyone for the questions that you sent in. The next Ask the Mayo Mom is on June 1st at 10 a.m. Central Standard Time. Dr. Marty Hartz will be joining us to discuss the hot topic of food allergies in children. There's been a lot of coverage in the media lately about peanut allergies and when to introduce peanuts in young children, and we will definitely be covering this. So please join us and send in your questions in advance, and we'll be sure to try and answer them during the show. Thank you, everyone, and have a great day.